Horizontal strabismus, an esotropia or an exotropia whose angle of deviation is greater up than downward by about 15 diopters is called V-pattern strabismus. This horizontal incompetence in vertical gaze may not be functionally significant and do not require treatment in all cases. V-pattern strabismus may be esotropia down and orthotropia up, esotropia down but less esotropia up, orthotropia down and exotropia up, or exotropia down but greater exotropia up. In cases of esotropia down and orthotropia up, the treatment is bilateral medial rectus recession with downward transposition or temporal transposition of inferior rectus of both eyes. In cases of esotropia down but less esotropia up, if the inferior obliques are overacting, the treatment is bilateral inferior oblique myectomy plus bilateral medial rectus recession, or inferior oblique myectomy of both eyes plus recession of a medial rectus and the resection of a lateral rectus. If the inferior obliques are normally acting, the treatment is bilateral medial rectus recession with downward shift of the insertion or resection of a lateral rectus with upward shift and the recession of the medial rectus with downward shift of the insertion. In the case of orthotropia down but exotropia up, if the inferior obliques are overacting, the treatment is inferior oblique myectomy of both eyes. If the inferior obliques are normally acting, the treatment is bilateral lateral rectus recession with upward shift, or recession of a lateral rectus with upward shift and resection of a medial rectus with downward shift. In the case of exotropia down but greater exotropia up, if the inferior obliques are overacting, the treatment is bilateral inferior oblique myectomy plus bilateral lateral rectus recession, or bilateral inferior oblique myectomy plus recession of a lateral rectus and resection of a medial rectus. If the inferior obliques are normally acting, the treatment is bilateral lateral rectus recession with upward transposition or recession of a lateral rectus with upward shift and the resection of a medial rectus with downward shift.